One of the most common and potentially dangerous mistakes some doctors make when treating senior women is to dismiss their symptoms simply as a natural part of aging, without conducting a thorough examination. When a doctor attributes symptoms to just old age without proper investigation, it can lead to missed diagnoses, delayed treatment, and worsening health conditions as people age. It's true that the body undergoes many changes, and some minor ailments may be more common. However, not every symptom or health issue should be automatically chalked up to aging. For example, fatigue, pain, memory problems, or changes in mood can be signs of underlying illnesses such as anemia, thyroid disorders, depression, or even early dementia. Ignoring these symptoms by attributing them solely to old age can prevent senior women from receiving timely and effective medical care. A responsible and trustworthy doctor should always listen carefully to your concerns, ask detailed questions, and run appropriate tests to find the root cause of symptoms. Simply saying that's normal for your age without further assessment shows a lack of diligence and can make patients feel undervalued or ignored. This attitude may also reflect ageism, where seniors are unfairly stereotyped or treated differently based on their age rather than their actual health needs. Moreover, attributing symptoms to aging without examination discourages patients from advocating for themselves or seeking second opinions. Senior women deserve doctors who respect their experiences and work with them to identify real health problems. For example, a new persistent cough should be checked for lung issues, not just written off as age-related weakness. Sudden changes in balance or frequent falls should prompt neurological or orthopedic evaluation rather than being dismissed. If you ever hear your doctor use phrases like, "It's just your age," or "Everyone your age feels this way," be cautious. While some age-related changes are normal, your symptoms deserve investigation. Ask your doctor what tests or assessments will be done to rule out treatable conditions. If your concerns continue to be dismissed, consider seeking a second opinion from a healthcare professional who will take your symptoms seriously. In summary, never accept vague answers that blame your health problems solely on aging. Proper diagnosis requires thorough examination and testing. Senior women should feel empowered to question and advocate for comprehensive care. Remember, aging is natural, but it should never be an excuse for neglecting your health or settling for poor medical advice. Always demand attentive, respectful, and evidence-based treatment that addresses your unique health situation. One of the most troubling signs that you might not be dealing with a trustworthy doctor is when they frequently suggest unnecessary tests or treatments, especially without a clear medical reason. For senior women, this can be particularly concerning because it may lead to physical discomfort, emotional stress, and financial burden, all without improving health outcomes. Sometimes doctors may recommend extra diagnostic tests such as blood work, imaging scans, or specialist referrals that are not truly needed. These tests might not only be costly but could expose patients to risks, such as radiation or invasive procedures. When these suggestions seem repetitive, unclear, or are pushed aggressively, it could indicate that the doctor is motivated by financial incentives rather than genuine concern for your health. It's important to understand that while some tests and treatments are necessary for accurate diagnosis and management, overtesting can do more harm than good. Unnecessary interventions increase the risk of false positives, leading to anxiety and potentially more invasive procedures that might not have been needed in the first place. Additionally, for senior women on fixed incomes or limited resources, these costs can become a significant burden and might lead to skipping essential medications or care elsewhere. A trustworthy doctor will always explain why a particular test or treatment is necessary, how it will benefit you, and what the potential risks are. They will take time to discuss the pros and cons and involve you in the decision-making process. If your doctor repeatedly asks, "Do you want this test?" or "Would you like to start this treatment?" without a clear medical rationale, it's a warning sign. It may indicate a sales-like approach rather than patient-centered care. Senior women should feel empowered to ask questions like, "Why is this test or treatment necessary? What are the alternatives? What happens if I don't do this? Are there risks involved? Could this be done later if needed?" If these questions are met with vague answers or pressure to comply quickly, trust your instincts and consider seeking a second opinion. A good doctor respects your right to understand and consent to every part of your care. Moreover, medical decisions should always be based on evidence-based guidelines and tailored to your individual health status, not on a one-size sales pitch. Some doctors may benefit financially from ordering more tests or prescribing certain medications, but that does not align with ethical medical practice. In summary, if your doctor frequently asks if you want unnecessary tests or treatments, especially without clear explanation, it's a red flag. Senior women should be cautious and advocate for transparent, honest communication focused on their well-being rather than profit. Seeking doctors who prioritize your health and provide clear reasoning behind every medical recommendation will help you avoid unnecessary expenses and potentially harmful procedures. One of the most frustrating and harmful experiences a senior woman can face with a doctor is having her health concerns ignored or dismissed without proper attention. When a doctor quickly brushes off your symptoms or worries as unimportant, it can leave you feeling unheard, undervalued, and vulnerable. 2. Untreated health problems. Many senior women know their bodies well and can sense when something isn't right. Whether it's unusual pain, fatigue, changes in mood, or digestive issues, these concerns deserve careful consideration. Unfortunately, some doctors may rush through appointments, fail to listen actively, or minimize symptoms by attributing them to normal aging or stress without thorough evaluation. Ignoring patient concerns is not just poor bedside manner, it can have serious medical consequences. Early symptoms of chronic diseases like diabetes, heart problems, arthritis, or even cancer might be subtle and easy to overlook. If your doctor dismisses these early warning signs, you risk delayed diagnosis and treatment, which can worsen your condition and reduce quality of life. A respectful and trustworthy doctor takes the time to listen attentively, ask clarifying questions, and validate your experiences. They understand that symptoms are the body's way of communicating problems and should never be discounted. If a doctor regularly interrupts you, rushes to conclusions, or tells you things like it's nothing or you're worrying too much, it's a clear sign they are not prioritizing your health. Senior women should be encouraged to speak openly and assertively about their symptoms. If your concerns are dismissed, don't hesitate to ask for a more detailed explanation or request further tests. You have the right to be fully informed and involved in your healthcare decisions. In cases where a doctor continually ignores your concerns, it may be time to consider finding a new healthcare provider. Trust is a crucial component of the doctor-patient relationship, and you deserve to work with someone who respects your voice and treats you with dignity. Ignoring patient concerns can also erode mental and emotional well-being. Feeling unheard can increase anxiety, stress, and feelings of isolation, especially in older adults who may already face challenges like loneliness or decreased mobility. A compassionate doctor helps reduce these burdens by offering empathy and reassurance alongside medical care. In summary, never accept quick dismissals or neglect when you bring up health issues. Senior women's concerns are valid and need thorough attention. A trustworthy doctor listens carefully, investigates symptoms, and values your input. If your doctor ignores your concerns or rushes to dismiss them, consider advocating for yourself or seeking a second opinion. Your health and peace of mind depend on being heard and taken seriously. One major warning sign that your doctor may not have your best interests at heart is if they suggest medications that are harmful, outdated, or inappropriate for your age or health condition, especially without clearly explaining the risks involved. For senior women, this can have serious consequences, as aging bodies often respond differently to medications compared to younger adults. As people grow older, their metabolism, kidney function, and liver efficiency change, which can affect how drugs are processed in the body. Some medications that were once common may now be considered unsafe or less effective for seniors due to side effects or interactions with other drugs. A knowledgeable and trustworthy doctor stays up to date with the latest medical guidelines and carefully considers your entire health profile before prescribing any medication. If your doctor recommends a medicine without explaining why it's necessary, what benefits you can expect, and what potential side effects or risks it carries, it's a red flag. You deserve full transparency about your treatment options so you can make informed decisions. For example, certain sedatives or strong painkillers might increase the risk of falls or confusion in older adults. Some blood pressure or diabetes medications may need adjustment to avoid complications. Doctors who fail to communicate. One of the most important aspects of quality healthcare, especially for senior women, is having access to a range of treatment options and the freedom to seek second opinions. When a doctor refuses to discuss alternative treatments or discourages you from consulting other professionals, it's a serious red flag that should not be ignored. Healthcare is not one size. Every individual's health condition, lifestyle, and preferences are unique, so treatment plans should be personalized. A trustworthy doctor understands this and openly discusses various treatment possibilities, including medications, lifestyle changes, physical therapy, surgery, or newer therapies. They respect your right to choose and want you to feel informed and confident about your healthcare decisions. Unfortunately, some doctors may act defensively or arrogantly, insisting their recommendation is the only viable option. They might discourage second opinions by suggesting that other doctors won't understand your case, or imply that questioning their advice is a sign of mistrust. This behavior can be especially harmful for senior women who may already feel vulnerable or overwhelmed by complex health issues. Refusing to discuss alternatives limits your ability to make well-rounded decisions and can trap you in treatments that may not be the best fit. For example, there may be less invasive or safer options that your doctor does not want to explore or disclose. It's crucial to know all your options so you can weigh benefits, risks, and impacts on your quality of life. Seeking a second opinion is a common and recommended practice in healthcare, especially when dealing with serious diagnoses, major surgeries, or long-term medication plans. A fresh perspective can confirm the original diagnosis, offer new treatment ideas, or highlight concerns that were previously overlooked. A doctor who is confident and ethical will support you in seeking additional advice rather than feeling threatened by it. Senior women should never feel guilty or disrespectful for wanting to explore alternative treatments or ask for another professional's input. These choices show that you are proactive about your health and want the best possible care. If your doctor refuses to discuss alternatives or gets upset when you mention second opinions, take it seriously. It may be time to look for a healthcare provider who encourages open dialogue, values your autonomy, and respects your right to be fully informed. In summary, refusing to discuss alternative treatment options or second opinions is a major warning sign. Senior women deserve doctors who offer comprehensive information, respect their choices, and support their pursuit of the best possible care. Empower yourself by asking questions, seeking options, and never settling for one-sided advice that limits your health and well-being. One common and harmful practice some doctors fall into when treating senior women is making assumptions about their health solely based on age, rather than evaluating their individual health status. This type of age-based stereotyping, often called ageism, can seriously undermine the quality of care you receive. While aging naturally brings certain physical changes, it does not mean every senior woman fits a generic mold of declining health or limited capabilities. Each person ages differently, influenced by genetics, lifestyle, environment, and medical history. Treating patients as if their symptoms or concerns are simply because of age, without thorough evaluation, overlooks their unique health profile and can lead to missed or incorrect diagnoses. For example, a doctor might assume that memory loss or confusion in an older woman is normal and dismiss it without investigating underlying causes such as vitamin deficiencies, thyroid problems, infections, or medication side effects, or they may decide against recommending surgeries or treatments based on the patient's age alone, rather than assessing overall fitness and potential benefits. This assumption-based approach risks denying senior women appropriate care or treatments that could significantly improve their quality of life. It also fosters frustration and helplessness when patients feel reduced to a stereotype rather than treated as whole individuals. A good doctor understands the importance of personalized medicine, where decisions are based on comprehensive assessments, including physical exams, lab tests, functional abilities, and patient goals. They avoid shortcuts or biases that come from age-based generalizations. Senior women should be alert to signs of this bias. If your doctor often makes statements like "you're too old for that," "that's just how it is when you get older," or "we don't do that for patients your age," it may be a sign they are not fully considering your individual situation. Don't hesitate to ask your doctor how they arrived at their conclusions and whether there are other options suitable for your health status. You have the right to receive care that is tailored to you, not one based on assumptions or stereotypes. In addition, advocating for yourself or involving family members or caregivers in discussions, can help ensure your concerns are taken seriously. Seeking second opinions is also advisable if you feel your age is being used as a reason to deny certain treatments or investigations. In summary, making assumptions based solely on age rather than individual health status is a harmful practice that can lead to inadequate care for senior women. Every patient deserves to be treated as a unique individual with personalized medical decisions that reflect their actual health, preferences, and goals. Don't accept ageist attitudes. Demand comprehensive, respectful, and unbiased care that truly supports your well-being. One of the most concerning behaviors a doctor can exhibit is pressuring senior women to make medical decisions quickly, without allowing adequate time to think, ask questions, or seek advice. Healthcare decisions, especially for older adults, often involve complex factors including multiple health conditions, potential side effects, and lifestyle impacts. Being rushed into a choice can lead to regret, mistakes, and even harm. Medical treatments are not one-size-fits-all, and every patient deserves time to understand the risks and benefits before agreeing to procedures, medications, or surgeries. When a doctor pushes for immediate decisions, whether it's to start a new medication, undergo a diagnostic test, or schedule an invasive procedure, it can create undue stress and pressure. This urgency may be driven by clinic schedules, financial incentives, or simply poor communication skills, but it ultimately undermines patient autonomy. Senior women, in particular, may need extra time to process information due to cognitive changes, hearing difficulties, or the involvement of family members or caregivers in decisions. They may also want to consider how treatments will affect their daily lives, long-term health, and personal values. A trustworthy doctor respects this need and encourages patients to take the time they require. They provide clear explanations, in simple language, answer all questions patiently, and offer written information to review later. They may also suggest follow-up appointments or referrals to specialists for more detailed discussions. If you ever feel rushed or pressured by your doctor, it's important to recognize this as a red flag. Good medical care involves shared decision-making, where you are an active partner rather than a passive recipient. You should never feel forced to say yes or no on the spot. To protect yourself, ask for more time to think about the options, request written materials or trusted resources to review, involve family members or caregivers in discussions. Don't hesitate to seek a second opinion if you feel unsure. Remember that urgent decisions are rare. Most treatments can wait until you feel confident. Rushed decisions can sometimes lead to unnecessary procedures, side effects, or outcomes that don't align with your preferences. Taking time ensures that choices are well-informed, thoughtful, and tailored to your health needs. In summary, pressure to make quick medical decisions is a warning sign that your doctor may not be prioritizing your well-being and autonomy. Senior women deserve doctors who respect their pace, provide clear information, and support informed choices. Empower yourself by insisting on the time and space you need to make decisions that feel right for you. A critical aspect of a trustworthy doctor-patient relationship is empathy and respect. When a senior woman brings up health questions or concerns, she deserves to be met with understanding, patience, and genuine care. Unfortunately, some doctors exhibit a lack of empathy or respect, which can negatively impact both the emotional and physical health of their patients. Empathy means the doctor recognizes and acknowledges your feelings, fears, and experiences. For senior women, who may face multiple health challenges, chronic pain, or the emotional toll of aging, feeling heard and supported is essential. When a doctor dismisses questions, interrupts you, or appears indifferent, it can lead to frustration, anxiety, and even reluctance to seek care in the future. Respect goes hand in hand with empathy. It involves valuing your input, honoring your right to understand your health, and treating you with dignity. A respectful doctor encourages you to ask questions, explains medical information clearly, and takes your concerns seriously regardless of your age or background. A lack of empathy or respect may manifest in various ways. The doctor rushing through appointments without fully listening, responding curtly or condescendingly to questions, ignoring emotional aspects of illness, such as anxiety or depression, minimizing symptoms or concerns as trivial, showing impatience or frustration when you seek